Good morning, everyone. So today we will have an introduction into the world of vaccines. It's a very interesting topic in the present day scenario, and I hope you will get some insights into how the immunologists and the scientists are trying to tackle the coronavirus epidemic through manufacture of vaccines. Okay. So, which, if you think about the most important inventions in the history of healthcare, what comes to your mind? So some of the important ones that I could recollect off the cuff, important, and they are innovative as well. So sanitation, simply hand wash, for example. So there was no hand wash in the earlier days before surgery. So there were a lot of infections. So that simple step solved a lot of problems in the surgical field. Anesthesia. So these are some of the important inventions. Okay, I will not elaborate because we have our own topic. So antibiotics. So prior to anesthesia, surgery was very difficult. You could not do all of these, right? Again, prior to antibiotics, the survival of wounded patients, post-operative patients was very less because there were a lot of infections. And in fact, today the fear is being expressed that if we recklessly prescribe antibiotics and we do not adhere to antibiotic regimens, there might develop antibiotic resistance to such a large scale that we might go into the pre-antibiotic era. Birth control pills. So these are simple inventions, seem simple, right? But it's so important because the population explosion can literally kill our resources. Prosthetics. So this is a very old invention actually because there are evidences that even in the Stone Age, there was the use of prosthetics to allow the permanently disabled person, maybe someone with an amputated limb, to walk or to lead a life. Okay, organ transplant, obviously, yes. So creating a new organ for someone who has lost his own organ. So someone who has a failed kidney, a failed liver, chemotherapy. So this is something to fight cancer. Okay, so let's delve into our topic of the day. So, immunization is one of the most phenomenal health interventions of all times. And why is that? Okay, it's a thought for you to think about. Think about. So, the learning objectives are that at the end of the session, you should be able to define what is a vaccine and what is immunization, explain the importance of immunization, list the various types of immunization with examples, and explain how different types of immunization work inside the body. So we are surrounded by pathogens. So this is a newborn baby just brought out into the world, and it's literally put into the environment teeming with viruses, bacteria, and parasites and fungi. So what are pathogens? So something which cause disease. Okay, so there are some of the bacteria which are present in our uh, aerodigestive tracts, that is our respiratory tract and our gastrointestinal tracts, some which are present in our urogenital tracts. So these are all known as commensals, or some with which we have a very symbiotic kind of a relationship. Okay, so the microbiome approach to living says that we are not one person, that I am not uh, Saket, or you are not X, or she is not Y. So we are a group of organisms uh, living in peace with each other. So group of organisms meaning I am one, and then there are millions of other bacteria and viruses. So those are not pathogenic, but these are pathogenic. Even the normal commensals can become pathogenic under certain circumstances, like if you're immunocompromised, either suffering from primary immunodeficiencies or secondary immunodeficiencies. But by and large, we are surrounded by pathogenic organisms. Just remember that. So how does our immune system? So immune system is something that protects the body from the pathogens. So they are out. They are our warriors. They are out to kill them. Okay. So So the first responders are the innate immunity, that is the skin and the mucous membrane, the barriers, the physical barriers. Okay, the physical barriers, and then there are certain molecules like the complement or the lysozyme, or there are others like C-reactive peptide or mannose binding lectin. So all of these molecules, they play a role, and of course there are phagocytic cells, cells like neutrophils, cells like macrophages. So they are going to come in. So they notice that there is something wrong, and as soon as they notice, they try to tackle the organism. Okay, tackling as in wrestling में जैसे धोबी पछाड़ देते हैं, so they try to get rid of them. At the same time, the innate immunity also activates a very refined, a very evolved system, which is found only in vertebrates. That is the adaptive immunity. So innate immunity is present even in the smallest prokaryote. So it's there everywhere. It's universal. But adaptive immunity is a highly evolved system of protective responses that is seen in vertebrates. So you can see here the dendritic cell and the macrophage. So they are part of the innate immunity. They are going to activate the B cells, the T cells. The NK cells, can be part of the innate as well as sometimes part of adaptive, but mostly they are part of the innate system. So these are the innate system, and that is your adaptive system, the lymphocytes, the B lymphocyte, the T lymphocytes. So the second line of defense is the adaptive system. So this is the highly specialized system we were talking about. So they will kill, but they will not kill they will not kill blindly. Chun chun ke maarte hain ye. So just like chun chun ke marunga was the dictum of Dharmender, the superstar of yore. So here these lymphocytes, the T cells, that is the CD8 T cell or the CD4 T cell or the regulatory T cell, and the B cells which secretes antibodies, right? So phases of the immune response, you're very well aware. The first phase is recognition. Because it's a very specialized, so both innate and adaptive will have this phase of recognition, but the adaptive system, of course, recognizes at a very specific level. So it will recognize, it can differentiate even single amino acids. So it will recognize a very specific person, only its lover, only its beloved, right? Only its partner. Once recognition happens, then they get activated. So Clark Kent removing his shirt to become Superman. So they're transforming into something known as effector cells. Once they have become activated and they have converted them into effector cell, for example, plasma cells, they will do the effector response. They will fight. So they will fight and eliminate. And the most important, not the most important, but also a very important part of the immune response is that they will store this information for posterity. So it will be stored in its memory. Okay, so this was a pathogen I had encountered in the past. So in the future, we have to again, so in the future, when the similar recognition happens, this particular, the activation and the effector response will be higher and faster. So this part, again, it will have to recognize, obviously. So in the future, but the second time the recognition happens, it will get activated very fast and it will respond very efficiently, even more effectively. So you have the antigenic exposure, the naive lymphocyte. So this naive lymphocyte count, you can see the naive lymphocyte count going up, okay, because the lymphocytes start proliferating and they get converted into effector cells. And with time, of course, once they have tackled the particular immunogen or the pathogen, they will die of apoptosis. So after the B cells and the T cells have performed their function, they'll die of apoptosis. They will fall in numbers. What will stay is memory. So these are apoptotic cells, but the memory cells will remain. The memory remains. Okay. So what does immunization do? So immunization does nothing but accelerate this particular immune response. So just like a Batmobile accelerates Batman through dark tunnels, so immunization will accelerate this immune response. It will fast forward. So what you just saw, that this particular phase, so it is going to accelerate this. You can say it is going to prepone this, so that you already have a memory stored. So by artificially exposing you or the host to a pathogen, so instead of allowing the natural infection to take place, you are artificially exposing it. And you are ensuring that this stage is reached. Okay. So you inject a vaccine. Again, the innate immune system, the first line of defense, dendritic cells, macrophages. The second line of defense, that is the adaptive immune system. So the these cells, dendritic cells, macrophages will take the antigen into the secondary lymphoid organs like lymph nodes or the spleen. So these are the cafeteria or the meeting spots, the restaurants, the malls, the movie theaters of the adaptive immune system. So you know that adaptive immune system, B cell, T cell, are genetically pre-programmed to recognize a unique antigen. So each B cell, each T cell can recognize only its partner, only its boyfriend, its girlfriend, its lover. So where will the meeting take place? In these cafeteria, that is the lymph nodes, the spleen, what we normally call the secondary lymphoid organs. I skipped one most important one, that is the mucosal associated lymphoid tissue, MALT. So the pharyngeal tonsils or the Peyer's patches. So those are also the cafeterias. So the vaccine first activates the innate system, then it activates the adaptive system. Of course, it leads to activation, the Superman transforming and the transforming into effector cells like cytotoxic T lymphocyte or the plasma cell or the activated T helper cell, all those things, and also the memory cell. So the effector cells and the memory cells. So naive cells, naive T and naive B cell getting transformed into effector cells and memory cells. So by giving a vaccine, you are allowing this process to happen before even natural infection has taken place, so that the ultimate goal is to achieve memory, right? So immunization outcomes are adequate levels of antibody. So yes, even that is one of the goals. So in case of some infections, you should remember that infections like influenza, for example, where the infection is going to happen very fast in 1 or 2 days. So there, only memory is not going to serve the purpose. You also need antibody levels in the blood. So unless the antibody levels are there, because the memory cells, they have to undergo all that process. They have to first recognize and then get activated and then do the effector. So that thing itself is going to take 1 or 2 days. So instead, you want pre-existing antibodies also to be present, so that immediately, instantly, as soon as the virus enters the body, enters the mucosa of the respiratory tract, it encounters the secretory immunoglobulin A, and that immunoglobulin A is going to neutralize the virus, not allow it to enter the respiratory epithelial cells. So that is how influenza vaccine works, by generating enough titers of antibody that it will prevent your infection. Similar is the case with your, for example, hepatitis B or hepatitis C. So hepatitis C vaccine isn't there, but hepatitis B vaccine is there for all the healthcare professionals. For example, when you become an intern, so you might get pricked by an infected needle, and as soon as you get pricked, there is a chance that the virus will lodge itself. So you don't want that to happen. So you want enough titers of antibody to be present, so that the virus is neutralized even before it binds to any of your cells. So that is known as prevention at the very earliest. So for that you need antibody titers. But there are some infections which take a long time to develop. Okay, so for them, even the memory cells, for them memory cells are more important. For example, polio. So polio will just go and infect your digestive tract. Okay, go and colonize your digestive tract. But the nervous symptoms or the nervous manifestations will take 3 or 4 days to arrive. So by that time, your memory cells are active and they can tackle it. So for polio, it may be more important. Even secretory IgA levels are important in polio as well, but memory cells are more important. So the two most important outcomes that you want out of immunization is adequate levels of antibody and primed memory cells. So like I said, only the memory remains at the end. So it was a song by Metallica. You can look it up later. So prior to moving ahead with immunization, I will like to remind you that immunization is but one way to protect against pathogens. Okay, so there are several other important ways to do it, which must not be ignored. So that is the role of the doctors, of the people in general, of the government, to ensure that other ways are also used. So these are, you will come across this in your community medicine classes. So these are public health measures that are very important in controlling disease. So like I told you, sanitation, like hand wash, okay, cough etiquette. So you must have been looking at videos of coronavirus, how to control the coronavirus epidemic. So you shouldn't cough out in the open, shouldn't cough into your hands. you should rather cup into your elbows or into a handkerchief like that. Okay. Food and nutrition. So washing raw food, cooking thoroughly. So many of the worm infestations, many of your viral diarrheas all manifest because of your food and nutrition. So because of poor quality of drinking water, which generally falls in the hygiene part. So there is, okay, in India, the lot of water is fecally contaminated. That means your sewage pipelines and your drinking water pipelines, they are not clearly separated at places, and there is a leakage which leads to poor drinking water quality and can lead to many of the diseases. Similarly, food and nutrition, animal and vector control. So you have mosquito nets, you have your good night and Mortines, and your mosquito repellent creams. So whenever you're traveling out in the jungle, okay, or traveling to a foreign country, you need to protect yourself from bug bites. So all of those. So that also can prevent you. You don't need uh, a modern immunization program for it. Okay, you just need to protect yourself from mosquito bites to counter malaria, for example. So of course, malaria vaccines are in trial and people are trying to search for a vaccine. But even the use of mosquito nets can cut down the death rate from falciparum malaria to about 60%. Okay, meaning by about 40%. Safe sex practices. So monogamy, of course, is cruel, as they say, and the use of barrier intercourse, that is condoms. So they are very important in protecting against sexually transmitted infections and the dreaded HIV or the hepatitis B or hepatitis C. And then, of course, immunization. So immunization, the importance cannot be overstated. So it's very important. We'll see how. So there are a growing number of diseases which we encounter less and less because there is immunization. So, for example, you will never, in your lifetime now, you will never get to see a person suffering from paralytic polio. Okay, someone older you might find, someone disabled, but you will not find people of your age group. So, if you look at documentaries of the 60s and 70s, okay, Dr. Fauci, who is leading the coronavirus team at US. So he, in one of his speeches, one of his talks in vaccination, he says that when he was a child, his friends who used to play with him would suddenly fall ill, and they won't come out to play for like 2 or 3 weeks. And suddenly, when they come out, they came out with a deformed limb, with a defective limb. They were limping, and then that limb got smaller and smaller and got thinner. And so that was a real life scenario at that point, that your friends will fall ill and they will contract polio. Similarly, tetanus. So if you have gone through your physiology experiments, you know what is tetanic contraction. Okay. So how it looks like, what is opisthotonus. So those kind of things, again, we generally don't get to see. Rabies, for example, I haven't mentioned here. So rabies is 100% fatal, as they say. I have only read about the symptoms of rabies. I'm yet to see a patient of rabies. So those are things which we don't find normally, like diphtheria. I haven't seen a case of diphtheria. Of course, there are things which we are still finding. So rotavirus. So you're not aware, but diarrheal diseases, that is excessive loose motions causing fluid loss and dehydration, is a very common cause of death in India among children. So in the West, of course, because of the good water quality, that is not a problem. But for our countries, for developing countries, and diarrheal diseases are a very big problem. And rotavirus is the most common causative organism among children. So nowadays, like in the last 10 years, rotavirus vaccine has developed. So we are seeing. So these are all vaccine preventable illnesses. So like I said, immunization is very important. So this is polio, this is tetanus. So when is vaccination used? Which are the ideal diseases in which you want to use vaccination? So the most important ones include those which are deadly, which can lead to death, those which may be permanently disabling. Okay. So they not only accrue personal benefits, that is, this person would not have suffered the fate they are going through. So so the pain and the suffering and the loss of life can be prevented, but they also have community benefits. That is the social burden of disease, the economic burden of disease. So you can imagine the kind of uh, opportunity cost that this person suffers. okay, the kind of economic losses that his family suffers. So all that are the community benefits of vaccination. So even the government, it's not only the parent of the child, the government has to bear a cost, okay, because this person will contract various other illnesses, will report to the healthcare system more often. So hospital expenditure increases. Like majority of the people in our country are poor, so they are going to use government healthcare facilities. So if you want that in the future the costs are reduced, you want to immunize, you want to vaccinate. So like I said, at the individual level, it controls the poor illness outcomes like death or disability, controls absence from school, absence from work also. So for adults, the economic cost, hospital visits, so the cost of treatment for the individual. At the community level, what else can happen is that, so this is known as control, okay. So what I just said in the previous slide, all of it was part of control. So poor illness outcomes, absence from work, decreased hospital visits. Elimination, what is elimination? So elimination and eradication are terms used for a particular geographic area. For example, Punjab, if I say that a particular disease is eliminated from Punjab or from India, I'm sorry, so that means there are zero cases of that disease, and that, more importantly, the indigenous transmission has stopped. So no transmission is happening from person to person in that area. Eradication, we say that a particular disease has been eradicated when this stage, the elimination, can be sustained without any vaccination, without the use of intervention. Okay, so for example, smallpox. So smallpox was first eliminated and then finally it was eradicated. That means the immunity was reached to a certain level that even immunization was not needed, because you knew that in that geographic area there was no possibility of introducing a smallpox again. Okay, so till the time there is a possibility, for example, right now, polio is virtually eradicated, but there are few pockets still left in the world. So in Pakistan, in Afghanistan, in some parts of Africa, there is polio still going on. So for that reason, even America is still vaccinating against polio. So it has not stopped. Why? Because at any point of time, it is possible that someone from these endemic areas can introduce polio back to that place. So still interventions are taking place. So polio is not said to be eradicated, but smallpox is said to be eradicated because no one is immunizing against smallpox anymore. So, so like I said, control by preventing infection. Example, diphtheria vaccine. These are some examples that I have just put for these particular things. I have just put examples. So preventing infection, example, diphtheria, reducing the severity of infection or preventing complications like rotavirus. So rotavirus vaccine will not actually prevent the infection from happening, but it will prevent severe gastroenteritis. So it will not allow the child to get dehydrated. It will not allow the child to die. Many of the influenza vaccines also perform the same function, that they will not prevent infection, but they will not allow it to progress to pneumonia. Okay. Zoster vaccine. So zoster is, again, it's a group of organism called herpes zoster. So the first infection that they cause is ulcers, but the second stage they can lead to nervous manifestations. So when it is simply herpes, these are called varicella zoster. Sorry, I'm sorry. So varicella zoster, no, yeah. So varicella zoster virus. So in the earlier stage it causes ulcer, but in the later stages it can cause nervous manifestation. So the vaccine controls against the nervous manifestation, the post-herpetic neuralgia. Elimination and eradication. So reducing transmission from infectious diseases. So how vaccine helps in elimination and eradication? Basically, by protecting the individual, it prevents these symptoms. But at the same time, it also does not allow that individual to become an agent of transmission. You're getting my point? So not only is the individual protected, he also becomes less harmful for the society because he cannot transmit the infection anymore. He cannot contract it, so he cannot transmit it. So reducing the transmission of infectious disease agents from immunized people to others. So that is also one goal. So this is an indirect protection. So we'll see what is herd immunity. Okay, you might have come across this term in recent times. So herd immunity means that the protection is indirect. So if let's say I'm not immunized, but I'm still protected. How? Because my neighbor is immunized, because my friend is immunized, because my brother is immunized. So if they are immunized, they cannot transmit the disease to me. So I become more likely to stay safe. So that is herd immunity. So in India, it started in around, I think, in the 1970s. Okay, it was called the Universal Immunization Program. It was earlier called the Expanded Program of Immunization. So at present, these are the doses. So for the pregnant woman, 2 doses are given in the third trimester of pregnancy. Following childbirth, the child is vaccinated with a oral polio vaccine, 0 dose. It's called the 0 dose because it is given at birth, and the BCG, which is given at birth. Nowadays, we have started giving the hepatitis B also. And then at 6, 10, and 14 weeks, we give oral polio vaccine 1, 2, and 3. And we give the diphtheria, pertussis, tetanus. So this is known as a triple vaccine. So we give 3 doses of that. See, the first dose is called a vaccine, and the subsequent doses are all called boosters. So these are all boosters. Polio, for example. So these are boosters of polio. For DPT, this is the first dose. These are boosters. Okay. So we call them boosters. And then at around 9 months of age, we give the measles vaccine. So this is MMR, or the measles, mumps, rubella. So we give that. Again, we give a booster of the same vaccine at around 16 to 24 months. See, there are various other vaccines which have been recently added, which may or may not be available at every place. So this is the Japanese encephalitis. So depending on the endemic area, like we had Japanese encephalitis epidemics happening in Uttar Pradesh. So in that region, we will want to immunize the children against that. Okay. So OPV booster, DPT booster is fine. And then again, DPT booster. So at 5 to 6. So here I have called these boosters, and that is how they are generally named. But you should remember that these are also after the first dose, everything else is a booster kind of. Okay. And then the TT vaccine. So this is nothing but tetanus. So you have already given the tetanus vaccine, tetanus shots, and the tetanus boosters, but you have to keep giving the tetanus boosters. That is the problem. So even at 10 years, so we say that every 5 years we give the tetanus shots, right? So 1978 was when it started, uh, and thereafter it has developed. So in 1995 we started the pulse polio program. So you keep hearing that every month or so, every month or 2 months, that there is a pulse polio immunization happening. So that is in addition to all this. Okay, so this polio regimen is for the individual child, but the pulse polio is for the community. So whenever there is a pulse polio day, every child under the age of 5 has to get immunized. So I'll tell you the reason why later. So these are some of the newer vaccines that have been introduced: Japanese encephalitis, um, injectable polio vaccine, rotavirus. Okay. So 2011 was the last wild polio virus case. So what is a wild virus? Wild is what is found in nature. What is pathogenic? Okay, what is pathogenic? The vaccine virus is something different. So the oral polio drops which we give also contains virus, but that is the vaccine virus. It is not the same as the wild type virus. It has been mutated to make it less harmful. Okay, so we'll see what it is. So new vaccines, like I told you, some new vaccines like the measles rubella vaccine, the pneumococcal vaccine, the rotavirus vaccine, the inactivated injectable polio vaccine. So apart from oral, injectable, and the Japanese encephalitis vaccine. So these are some of the newer ones that have been introduced in the past 10 years. Okay. Overall immunization coverage gradually is increasing, but we want, see, ideally we will always target 100% vaccination, but there are pockets of the country which are really inaccessible to the healthcare system. So that is the problem why many of our children are yet to be vaccinated. Okay. So I think I will divide this lecture into a couple of parts. So this is the first part that is going on, because otherwise it becomes very long. So now we'll start with what has been the success of immunization. So as you know, Newton said that he could see far only because he was standing on the shoulder of giants. So today, after the first case of coronavirus was reported in December, we already have around 100 vaccines in development. So that is a huge achievement. Within a couple of months, the vaccine development has started in many of the laboratories, and A particular lab in Oxford is already claiming that by August they will be able to get the vaccine out into the market. So that's a big achievement, only possible because of various immunologists who have been working on the science of vaccine. So we have eradicated smallpox. So these are the successes. We have eliminated poliomyelitis, like I said, from most of the countries. And we have achieved significant decline in the incidence of measles, tetanus, diphtheria. So like I told you, I haven't seen a case of tetanus or diphtheria. So definitely it is a success story. I haven't seen measles as well, but I'm sure pediatricians have. But there is still the unfinished agenda. So if you have seen Kill Bill, um, so what's her name? I forgot her name. So she calls out Oren. Okay, you can watch the movie to find what is the unfinished business. So unfinished business for the vaccination program, of course, is the big H or the HIV, but there are also others like hepatitis C. Okay, there is tuberculosis, malaria. So these are the common ones because TB affects a large population in the developing countries. So ditto for malaria and the new emerging infections like COVID-19. So because it has caused a pandemic, of course, it remains a very big challenge to develop a vaccine against it.